I'm here with Victor Huber, Associate Professor at the University of South Dakota, who's going to talk to us today about monitoring SARS-CoV-2 and how it can be monitored on a community level through wastewater testing. Also here today is Bonny Specker, epidemiologist from South Dakota State University, who's going to give us an update on what's been happening with COVID-19 in our area, in the nation, and in the world. But I'll start with Victor. Now, Victor, tell me a little bit about what you have been working on lately.
So, like many scientists in the last year, we've been focusing a lot of attention on this new virus, SARS-CoV-2, that emerged, just over a year ago. And we're trying to understand a lot about, how it's infecting people, develop things like vaccines. And one of the things we're focusing on is surveillance of the virus in the community. And specifically, we're using wastewater as a way to detect whether or not the virus is circulating within a community, rather than doing, say, individual testing of people to find out who's infected. You can find a lot from wastewater with this virus as far as determining whether it's in the community or not, and how it's spreading in the community.
So Victor, can you show us kind of how that works, or kind of an overall demonstration of what this kind of testing is?
Sure, I'll put in this slide and say, this study was sort of following in line with a number of other places that are doing similar testing in their wastewater. The most notable is the University of Arizona, where they were able to actually use this type of testing in order to identify a potential outbreak of COVID-19. And they did this at a dorm-specific level, so they were able to sort of shut down that dorm so that they didn't have that outbreak. And this is in collaboration with Lisa McFadden and Jamie Scholl at the University of South Dakota. And we've been collecting samples since July 10th, 2020 to the present. And what we're seeing is, if you look at the detection of the RNA for the virus in specifically primary sludge, going from August 2020 through October, you can see an increase in the detection of the RNA in the sludge samples that sort of goes right over the bars of the active cases in the community that we were seeing during that time. And so we've analyzed the data out that far, but it seems to make a nice connection with what's happening in the community. At the current time, we're still processing the more recent samples, and we're hoping to continue with this type of testing moving forward, especially into the post-vaccine era, where we're still going to want to know whether or not the virus is moving through people in the community even after vaccination.
Where do you get those sludge samples from? Where do you take them from, and what areas?
So right now we're just testing the city of Vermilion, just their wastewater and sludge samples from the water treatment plant there. And we don't have anything more specific to like University of Arizona had the individual dorms. We really can't focus down on that specific of a level at this time. We're just doing the entire city.
So moving forward with the pandemic, how could this be used in the future by other communities?
Well, I think, a number of places are already, doing this type of testing. Different cities and states are implementing this. As I mentioned, one of the things that I'd be interested in as someone who's been working with these viruses and looking at, vaccine development, looking at potential mutations in the virus and how that might affect, be affected by the vaccine-induced immunity. I'd be really interested to see how these types of things carry on into the next few months and years of our experience with SARS-CoV-2, as we learn whether or not this virus is going to stay around, or if it's going to eventually go away after a successful vaccination campaign.
So my question is, why do you think, I know your area of expertise is in influenza, so why do you think the numbers of flu are so low this year?
That's an excellent question. There's a lot of, sort of ideas that maybe some of the social distancing measures we're using, some of the, masking and things like that are helping to limit the spread of influenza. But at the same time, we're still seeing pretty widespread, transmission of SARS-CoV-2. And, there's a lot of things out there. One thing could be just, that the SARS-CoV-2 is maybe outcompeting the influenza infections right now. This could be something that's going to only happen this season, or it could be something that eventually, affects our what happens with influenza. When we had the pandemic in 2009, there were actually there was a 2008 variant of H1N1 and the 2009 variant of H1N1, and that 2009 variant just replaced the 2008 variant. It is something we've seen with influenza throughout the years, and it may have just been an out competition of the current, the previous isolate, previous type, and that might be what's happening here. But we just have to sort of see. The good thing is that influenza numbers have been quite low, which is definitely a positive.
So with your background in influenza, Victor, I'm just curious, how does COVID-19 and the flu kind of compare when it comes to that secondary infection tending to be the cause of why people get very ill or very sick? How are they similar in that sense, and how are they different?
That's a great question. And, with influenza, one of the things that we do study in my lab are these secondary bacterial infections, and how, primary influenza infection can cause your immune response to be affected in a way that leaves you susceptible to a secondary bacterial infection that often leads to pneumonia and then death. And that's well established with influenza. They're still trying to understand all the immune mechanisms behind it, but we know that there is, a primary viral infection. Oftentimes, individuals will start to feel better, and then you get a secondary bacterial infection that is very devastating and very difficult to treat, even with antibiotics. With SARS-CoV-2, there doesn't seem to be that direct connection with, say, a secondary bacterial infection. A lot of times you've heard stories of, a secondary sort of viral infection or secondary sort of just illness. We don't really know yet if the virus just persists and then sort of reemerges, or exactly how it's happening. And those are the things that we need to learn over the next few months and years as we understand more about the disease that's caused, by SARS-CoV-2. But those are some of the ways that it's similar, but then also very different. Is that, and part of that may just be we've had a lot of time to research influenza, and we haven't had a lot of time to research SARS-CoV-2.
Well, thank you, Victor. Is there any other details that you think that the public should know about what you do? And is there any just fun facts that you'd like the public to know about what you've been doing?
One of the things that would be interesting to do from this as well is maybe eventually get the ability to do actual sequencing of these viruses. I think the technology is there to eventually understand if there could be detection of variants that might arise, before we actually see them, in the community, and be able to detect them and sequence them, much like we're seeing these new variants already start to arise with these SARS-CoV-2 viruses. This might be a tool that would allow us to have a bit of a head start on some of that.
Yeah, that really does make sense. Obviously, not everyone's going in and getting tested because they might not have symptoms, but they might have the virus that they're putting into the wastewater system, and you would be able to pull it from there, and that would be very telling. So it'll be interesting to see what happens with this. Thank you so much for talking to us about this today.
Thank you very much for the invitation to chat, and I'll let you know if I have any other updates in the future to bring to your attention.